Attention deficit hyperactivity disorder, more commonly known as ADHD, is one of the most common neurodevelopmental disorders amongst children. Everyone can have difficulties standing still sometimes, or even focusing. However, for children diagnosed with ADHD, the behaviors become severe problems that interfere in multiple aspects of their lives, such as at home and at school. Here are 5 things you should know about ADHD. Number 5. The most common symptoms of the disorder are inattention, hyperactivity, and impulsivity. A child might struggle with one of these symptoms or all 3 combined. Other symptoms include excessive talking, constantly fidgeting, acting without thinking, forgetfulness, and disorganization. Number 4, there are 3 different types of ADHD: the hyperactive and impulsive, the primarily inattentive, formerly known as ADD, and a combination of both. As the description implies, the first type focuses on hyperactivity. They always fidget and they can't keep still. They also struggle with self-control. The second type, ADD, has difficulties sustaining attention and therefore may be very distracted and have weak memory skills. And lastly, the third type would be a combination of both hyperactivity and attention deficit, having at least 6 symptoms of each previous type. Number 3, people with ADHD don't have trouble paying attention. They're actually very good at focusing when they are interested in what they are doing. This is called hyperfocus mode, and even though it is not always a negative trait to have, sometimes it could be very frustrating for parents, for example, when they're trying to call their child to come to dinner, to do the homework, or for them to do chores around the house without having to remind them 1,000 times. Number 2, it can cause social issues and emotional distress. Having this diagnosis as a child can have an impact on your self-esteem. They wonder why they always forget things or why can't they keep still. Moreover, children with ADHD can have trouble managing their emotions that can lead to them shutting down. Being mindful of this can help you manage your own child with ADHD in a more empathetic way. Remember, they did not ask to have this diagnosis. And number 1, there are few treatments possible for ADHD. One of the most common treatments is therapy, including psychoeducation, behavior therapy, social skills training, and cognitive behavioral therapy. Some medication can also be very helpful. They can be taken every day or only during school days. And lastly, we have other methods such as keeping a healthy diet and getting supplements. If any of these relate to you, or as a parent you have any concerns, reach out to your primary doctor for a consultation. Remember as well that even though mostly diagnosed during childhood, ADHD can also be seen in adults. ADHD can be manageable with the right treatment, so don't be afraid to reach out to a professional for help regardless of your age.